going.
Okay. Okay, today we're going to be talking about tuberculosis.
Tuberculosis is caused by a rod-shaped bacteria called Mycobacterium tuberculosis. It has a thick hydrophobic and mycolic acid-rich cell wall made of peptidoglycan and arabinoglycan. It is a gram-positive bacteria due to the peptidoglycan. The disease is caused by aerobes releasing aerosol that spreads the infection. It destroys pulmonary tissue, causing cavities in the lungs. And as shown by the figure next to it, is rod-shaped and it stains bright red.
How is TB acquired? TB is spread through the air from one person to another. So if somebody who has TB is to cough or speak around somebody who doesn't, the other person can inhale it or have the droplets. TB has been linked to some environmental factors such as overcrowded living, indoor air pollution, tobacco smoke, malnutrition, and excessive alcohol use.
Symptoms typically begin their presentation about 2 or 3 weeks after a person becomes infected, but there are also cases where people don't start to present symptoms until years later. Most of the common signs and symptoms are a persistent productive cough that might be bloody. The cough lasts longer than 3 weeks. It's also accompanied with chest pain or pain with breathing, fever, chills, and fatigue, a loss of appetite, which causes unintentional weight loss, and night sweats.
How is TB diagnosed? You can diagnose TB by doing a tuberculin skin test. This is where tuberculin, a TB agent, is injected into the skin of your forearm. Your reaction to the injection determines the extent of your immune response. You can also do a CAT scan, which will confirm pulmonary TB. You can also do a sputum culture test. The sputum is a culture for the presence of the bacteria with a special stain, usually done after a skin test. The interferon gamma release assay is a blood test to confirm or rule out latent or active TB.
If tuberculosis isn't treated properly, it can prove to be fatal, but survival rates for people who contract TB in the present is usually pretty good, like 85% survive globally. This is highly improved from the 1800s, where there would be around like 900 deaths per 100,000 people in the population. TB can cause long-term damage to the lungs in people who contract it, especially in cases that aren't treated in a timely manner. Treatments are mostly antibiotics. For latent tuberculosis, they use isoniazid and rifampicin, and then for active tuberculosis, they use pyrazimide and ethambutol. And there's a few different adverse effects, but the most common are anorexia, easy bruising, and blurred vision.
All right, some facts about tuberculosis. About a quarter of the world's population is infected with TB. Only a small portion of people infected with TB actually present with symptoms, and people with a weak immune system are more likely to become ill from TB. TB is a disease that spreads through the air from person to person. Although TB usually affects the lungs, it can also affect other systems of the body, such as lymph nodes, joints, and bones.